Hello. The biggest fear for any patient who is about to undergo any anatomical surgery for be it piles, fissure, or fistula is it, sir, whether I will be able to pass my stool normally or not. Almost all the patients who I counsel for any of the anatomical surgeries, they have this question. So, well, frankly speaking, based on my experience, it should not be a problem if it is being operated by an experienced or skilled surgeon. The worst you can expect is pain or discomfort or burning sensations during or after having motion. There are certain ways or certain techniques which I advise to all my patients, such as sitz bath, application of certain ointment before and after taking sitz bath, and laxatives, which are start from the day first, so that the consistency of the stool remains soft. All these techniques helps in minimizing the pain and discomfort. And trust me, by 10 to 14 days, this the component of the pain subsides gradually, and after 14 days, usually it is almost less than 10% of the intensity of the pain which you experience on postoperative day 1. Next thing is, after any anatomical surgery, you won't be having the urge to pass motion for the next 3 to 4 days. Don't worry so much about it because it's a normal phenomena. However, having said that, if you happen to have motion, if you want to use the toilet on day 1 or day 2, don't worry so much about that. What I'm trying to say is that majority of the patients freak out if they are not having motion on day 2 or day 3, and they constantly message me or call me, sir, I am not able to pass motion. Don't worry so much about it. It's a normal thing. And usually these things are mostly seen in those patients who are completely bed rest for 3 to 4 days after surgery, or the water intake is less, or they are not taking their laxatives, or even they are eating less. So that's why I specifically encourage all my patients to involve yourselves in your household chores, or at least a daily walking of around 30 to 45 minutes from day 2 or day 3, provided you are not having a headache. Sometimes after the surgery, if you are being given a spinal anesthesia, 5 to 10% of the patients have a postoperative spinal headache. In those patients, I encourage bed rest for 3 to 4 days. But apart from that, if you're not having any symptoms of headache, then I encourage active movements, because this fastens up the recovery process, and also it helps the gut or the digestive system to work well. And also, some patients eat less than their normal appetite. Why? Because they think if they have to go to the toilet, it might pain. They have a fear of going to the toilet, so they eat less. But it causes a negative effect. How? If you eat less, it causes constipation. If there is constipation, the stool becomes hard, and hard stool is more difficult to pass. So, what I encourage is the normal food which you eat in the same proportion or same amount before surgery. Take that much amount of food. Just avoid meat products or processed food. Also, a water intake of more than 3 liters is advisable. Now, coming to the toilet sitting habits, well, usually whatever sitting habits, whether you are using Western or Indian, you can use that toilet after surgery. There is no such restrictions. The only thing which I advise is to avoid excessive straining after surgery. Why? Because if you strain too much, if you put too much of pressure, there's a possibility that the stitches might give away. Having said that, that doesn't mean while you're sitting on a toilet seat you should not strain. You need to strain, but just avoid excessive straining. Also, one thing which is commonly encountered after surgery is कि after motion or during motion, some amount of bleeding. You can see few drops of blood in the toilet seat. This is also a normal phenomena, because there is a wound is there, and it is getting daily irritated by the passage of stool. So few drops of blood are normal, but if the bleeding is severe or excessive, do consult your doctor immediately. Thank you.